Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. The movie's gonna make me a big star.
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe. So, legislative activity, legislative avocation is something that's always been very dear to me because I learned at a young age that things that happen in Austin, things that happen in Washington very definitely will affect our lives. And as a young adult, one of the first experiences I had was with the golden-cheeked warbler. And this is a yellow bird that flies and nests in trees that are not even native to Texas. But this became the federal government's way of telling us how many cattle we could run on an acre, which at the end of the day became a subtle way to begin to control land use in Texas. And as many people know that we are very different than the rest of the United States, 95% of Texas is privately owned, whereas if you go west of us, a third of the land is owned by the federal government. So Utah, New Mexico, California, Washington, all that, those are basically federally controlled states. Texas is not. Texas is still, again, in private hands. So when the federal government tried to protect the golden-cheeked warbler from nesting in cedar trees, basically junipers that aren't native to Texas, that rattled my family's cage and got me interested in legislative activity. So the healthcare spending has been an issue since I was in medical school. And I can remember Hillary Clinton coming out and saying after her husband was elected and she was going to reform healthcare that the problem in America is we have too many specialists, and specialists are expensive and specialists deliver expensive care. So the push became to retrain doctors to become primary care physicians and to funnel care towards gatekeepers and primary care doctors. And that has its pluses and minuses. One of the things it has caused is a huge explosion of imaging. So when I was in training, there were roughly 3 CAT scans in the area that I was training in Dallas. And now there's a CAT scan and an MRI and all kinds of scanners on every corner. And so that does allow us to look in the body, but it also shows us things that we aren't interested in. So many times I will see patients who have seen their primary care doctor or seen a cardiologist and then have neck pain or back pain. So that doctor, well-meaning, will go ahead and order a scan to see what's wrong. But at the same time, that begins us to show things that aren't wrong that just happen to be there. And so when people get into their 40s and 50s, about a third to upwards of a half of MRIs have something wrong. Arguably, it's not wrong if it's half the population, but it's something that's abnormal. And so the question is, well, then what do you do with this information? The flip side of that is the most common thing I see is somebody who's had an MRI or who's had a CAT scan and is told there's nothing wrong, that there maybe is just some arthritis, but there's nothing wrong. And that's, again, being told to the patient by a non-specialist doctor oftentimes, but not always. It's not that there's nothing wrong, it's just that medical doctors with this very advanced imaging we have are used to seeing abnormal scans on half the patients. So unless it's really dramatically wrong, they usually tell the patient there's nothing more than just aging, wear and tear, or arthritis. And that is just actually not always the case. So what is not commonly understood as we look at the spine and the white here are the bones, the yellow are the nerves, the reason nerves hurt is because they're pinched. And one of the reasons a pinched nerve hurts is because it doesn't have enough blood supply. So it's like taking a rubber band, putting it around your finger turns blue, it starts to hurt. It's because there's not enough blood flow going into the finger. Much in the same way we do an MRI of the spine and we see a bunch of calcium deposits up and down the spine. It kind of looks like arthritis, which at age 58, Mrs. Jones, is just normal arthritis. But the thing is, if that calcium deposit is located in a place to diminish or cut off the blood supply to that nerve starts to hurt. Yet the calcium deposit 3/8 of an inch over to the side, since it's nowhere near the blood supply, looks exactly the same as the one that was right next to the blood supply. And so it's interpreted as just another calcium deposit, not at all causing trouble. So that's why we can have MRIs that are interpreted as nothing wrong or interpreted as looking horrible, yet the patient's not that bad, is because not all calcium deposits, not all pinching is the same. It has to do with the blood supply and the ability of the nerve to move in and out of the spine as we move our arms and legs up and down. That's where some gray hair, experience, and a physical exam where you physically go in and pull on the nerve, stretch the arm, stretch the leg, rotate the hip, try to move that nerve in a way that's going to cause it to lose its blood supply. And the patient say, that hurts, really helps. And one of the things that I find interesting is the number of times patients say to me, wow, I've never had anybody examine me like that. And in part, that's because a lot of our care is being delivered by non-specialists, for better or for worse, or for specialists who have just gotten too dependent on technology. And one of the benefits I think I have is I grew up in the era where the technology was emerging. So we had to physically go and examine patients and move their arms and move their legs and push on this and pull on that to make a diagnosis. So that's sometimes why medical doctors, practitioners have trouble arriving at the diagnosis, is because they've gotten too dependent on the technology. So anyway, I'm here to help. I'm happy to see you. I hope you've enjoyed the C-Spine Show. Please like and subscribe. You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe.
Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And who's gonna make me a big star?